This module and the next 5 series of modules will discuss your baby's development. This module will focus on your baby's development at 4 weeks. Babies are born with involuntary reflexes which help them adapt to their new environment. When a newborn's cheek is gently stroked and the corner of their mouth is touched, a rooting reflex occurs. This causes the baby to turn their head in the direction of the touch and their mouth to open in search of a nipple for feeding. Stick your finger or an object in your baby's hand and you will see a grasping reflex cause their fingers to curl around tightly. The tonic neck reflex occurs when your baby is placed flat on their back. Their head will turn to one side with that side's arm extended and the opposite arm and leg will remain flexed. The Moro reflex occurs when a baby is startled by a sudden movement or a loud sound. Afraid that they may be falling, their arms and legs extend while their back arches, and then their little clenched fists and arms are pulled abruptly back towards their chest. When the bottom of your baby's foot is gently stroked from heel to toe, the Babinski reflex occurs. This is when the big toe separates and the other toes fan out and upwards. In the stepping reflex, when your baby is held upright and their feet touch a flat surface, they attempt to walk. Your baby has been curled up and confined for many months inside the womb. Because of this, their muscles will take some time to gain strength. At first, their heads will be too heavy for their neck to support. Always support their head and neck with your hand and arm. As you lift and carry your baby, holding them close to your own body will help them feel safe and secure. During these first few weeks after birth, newborn hands may often remain clenched into fists as they were confined in the uterus. This is normal at this stage of development. Hand closing occurs as the result of the grasp reflex activating as their fingers touch their own palms. When your baby is hungry, they often will put their clenched fist in their mouth. Wrapping your baby snugly in a blanket makes your baby feel protected as they continue to adjust to living outside of the womb. A swaddling folding technique keeps your baby cozy and warm safely. The picture on the right illustrates how to swaddle your baby correctly. In step A, the baby is placed directly in the center of the blanket. In step B, we can see arrows indicating what part of the blanket should be folded and what direction the folding should go. In step B, we can see that the arrows point to the left position, implying that this part of the blanket should be folded towards that direction. Step C shows what it should look like after step B has been carried out. In step D, we can see that the bottom part of the blanket should be folded upwards around the baby's shoulder. In step E, step D has been completed, and the last part of the blanket should be folded to the right and wrapped around your baby. Step F depicts the end result. It is important to know that in the first month of life, your baby is likely to sleep for 16 hours of the day. To enhance your baby's crib time, you can place a cribmobile, black and white objects, or a safe mirror with them while they are sleeping. If you choose to hang a mobile above your baby's crib, be sure to place it no more than 8 to 12 inches above their view and position it off a bit to one side. This is the distance within which your baby sees best right now. Your baby will be most attracted to high contrast patterns that are bold or bright. Black and white objects will send the strongest signals to your baby's brain. The part of the eye responsible for seeing black and white in your newborn is more developed than that for color until they get a bit older. An unbreakable crib mirror will provide your baby with a view that changes and reacts to their movements, helping them to improve their focus. Although your baby may sleep for 16 hours, it is important to know that your baby will communicate with you. Your baby is most likely attuned to human voices already and knows when others are nearby. Talk to your baby with gentle tones and sing lullabies. Your baby's main way of communicating with you is through crying, but they are beginning to show distinct facial expressions to express their comfort or displeasure. Your baby will yawn when overstimulated and needs a rest from activity. A clear grimace may also be seen when they are not very happy. Thank you for listening.